Welcome to In Good Shape. Coming up, how babies can help dementia patients. Why many vacations begin with a bout of nausea. And what endangers kidneys and how best to keep them healthy. And here's our host, Dr. Karsten Lekoutat.
How are your kidneys? You don't know? That's no surprise, because many kidney diseases are not painful at all. But they still might be dangerous. And that's what I'm going to talk about with our expert today, Dr. Andreas Kahl, here at the Berlin Charité. Welcome to In Good Shape.
If serious kidney diseases are not treated right away, it can have disastrous consequences.
The kidney is a very complex organ, and it controls many things in your body. It gets rid of waste, it controls your blood pressure, but many things can go wrong.
André Martin had extremely high blood pressure, but didn't even notice it. So he also had no idea that something was wrong with his kidneys. High blood pressure can be an early warning sign of a problem with your kidneys. And when blood pressure is permanently high, it in turn harms blood vessels, including those in the kidneys. Water retention in the legs is a further indicator of kidney disease, although by the time you notice it, then the kidneys will in most cases already be severely damaged.
The first symptom was swollen feet. I only noticed it because I could no longer put on my slippers, and I don't really recall being in pain. I didn't give them a good prod like Professor Benzing just now. All I saw was that they'd gotten a bit fatter, and then my wife said they needed to be looked at.
The problem with kidney disease is that it doesn't hurt. There are indirect signals, but there's no pain as such. And that often leads to the condition being diagnosed very late on. By then, the kidney stops functioning, and that function can no longer be replaced.
And by the time André Martin arrived at the Cologne University Hospital, his kidneys were already damaged. The filter system that normally removes toxins from the bloodstream was no longer working properly. The doctors tried everything. The hospital has one of the world's leading research centers for kidney disease. Professor Benzing heads an international team of experts specializing in kidney filtration.
The research being conducted here aims to improve our understanding of how kidney disease comes about. Our hope is that the advances made in the past few years will enable us to develop new therapies.
New insights on kidney filtration have enabled scientists to develop a new drug tailor-made for patients like André Martin. The medication is designed to prevent any spreading of damage to the kidneys.
Every day the kidneys filter around 180 liters of so-called primary urine. Although this is then concentrated into 1.5 liters actually being passed out of the body, there are 180 liters being filtered out of the blood. And that takes place in 1 million mini-filters in the kidneys. And unfortunately, in many cases, they are sick, which is what leads to chronic kidney disease.
It was in this laboratory that a young researcher first observed those tiny renal corpuscles and their filters. They're tasked with detoxifying the body by removing pollutants from the blood. When they don't function properly, they let the toxins through. That's why André Martin's urine contains protein, which has no business being there.
When people first find out, naturally they don't think it could lead to some life-threatening condition. And if it's their first time, they're not really prepared for it. Then they realize it's not just some cold that will go away again in a day or two.
Damaged kidneys are a common cause of death among patients with high blood pressure. The doctors in Cologne will not be able to get André Martin's health back to 100%, but they can slow the progression of the disease and prevent kidney failure.
We're here with Dr. Karl, who's the head of the Nephrology and Intensive Care Department at the Charité in Berlin. Thanks for inviting me into your clinic.
Thank you for visiting us.
Most kidney diseases are not painful at all. Why is that?
The reason for this is that there are only nerve fibers for pain in the capsule of the kidney. But most kidney diseases occur in the inner part of the kidney. So most patients do not have any pain feeling when they get sick with their kidney.
But that might be a problem, because if you are sick with the kidney and you don't know about it, so how should you know that you have to go to see a doctor? What are the symptoms?
There are some symptoms. The most important symptom is high blood pressure. And if you have a new diagnosis of high blood pressure, then you always should check the kidney function. Another symptom is that you can get edema in the arms, in the legs, in the eyelid. This is also often common in kidney diseases. Some patients feel very weak or have nausea and vomiting. And this may be also signs of kidney disease. Some patients also feel itching, or they have an uncomfortable smell out of their mouth.
Right. And what are the main causes for kidney diseases?
The main causes of kidney diseases, there are two causes. They are diabetes and cardiovascular diseases. That means diseases of the heart and of the blood vessels. And these makes, at least in Germany, 50 to 60% of all kidney diseases.
There's a condition called chronic kidney failure. What's that about?
Chronic kidney failure is defined as a disease which lasts more than 3 months. So when the kidney is insufficient for more than 3 months, then we call it kidney failure. Or if the proteinuria, the protein amount which is excreted by the kidney, is elevated for more than 3 months, then we call it chronic kidney failure.
And the reason for that might be the diabetes you spoke about,
Yes.
or the hypertension, the high blood pressure, or it might be the doctors who might actually damage the patient kidneys by prescribing pain medication.
Ibuprofen and diclofenac belong to a group of medicines called non-steroidal anti-inflammatory drugs, or NSAIDs. They're used to relieve pain. But a study suggests that if consumed regularly and in high doses, they increase the risk of kidney failure.
I probably exceeded the correct dosage, and that caused damage to my kidneys.
These pharmaceuticals reduce the synthesis of enzymes called prostaglandins. They're responsible for pain sensation and inflammation, but also have an impact on processes in the heart, stomach, and kidneys. And if production of the enzymes ceases, those organs can suffer damage. Birgit Windels was given an injection of diclofenac for backache and collapsed.
15 minutes later, the ambulance arrived, and they asked me if I could walk down the 2 flights of stairs. I said yes, and that's the last thing I remember.
Windels fell into a coma. With both her kidneys and liver threatening to fail, she was put on dialysis. It took her 11 days to regain consciousness. Back home in Germany, her doctor was appalled at her colleague's decision to inject diclofenac.
It's no longer approved for this form of administration due to the potentially life-threatening and even fatal side effects.
Nonetheless, the doctor continues to hear of cases of diclofenac being injected straight into a muscle. Many other medical professionals appear unaware of the danger involved. Daniel Buschau took pills to combat his inflamed joints so that he could do sports without being in pain. As a result, his kidneys are now in bad shape.
I was prescribed diclofenac, ibuprofen and naproxen, primarily for the anti-inflammatory effect.
But because he loves sports, he wanted to be active again as quickly as possible. Innocently thinking he was helping himself, he took a far higher dose than his doctor had actually prescribed, or which would make sense, medically speaking.
The drugs in question do provide relief from pain and inflammation. Most patients do not know about the risks, however, and are therefore a little lax in their use of them. Doctors are now calling for more patient information and safeguards.
When you're in pain, there are sound reasons to take the medication. But at the same time, the doctor needs to test the patient's blood.
So it's best to be careful with non-steroidal anti-inflammatory drugs for the sake of your kidneys.
Dr. Karl, if a patient suffers from a severe kidney disease, dialysis might be the last chance to survive. So we're here in a room where you perform dialysis with a patient. Mr. Gast, danke, dass wir heute bei Ihnen sein dürfen. Thank you. Could you please just explain what you do here?
Yes, sure. To perform a dialysis, you first need dialysis access. This is called dialysis shunt. This is a fistula between artery and vein. And after a few weeks or months, the vein enlarges and enlarges more and more, and so you can stick into this shunt cannula to get blood flow of 300 milliliters per minute, which is necessary to have an efficient dialysis.
Just to make sure, this bluish lump we see here is a vein.
This
the
is a
surgeon
vein.
clamped the artery together with veins, so
Yes.
the vein enlarges, and there's more blood flow, and it's
Yes.
easier for you to put a needle into.
Yes, and we have the high blood flow.
Okay.
Yes, and that's the point. We need the high blood flow, and the blood is going to this so-called dialyzer. A dialyzer is a filter which contains of more than 1,000 capillaries, which a diameter each of 100 to 200 micrometers. The blood is flowing through the capillaries of the dialyzer, and on the outer side of the capillaries there is a dialysis fluid. This is a very pure fluid with some trace elements in it, and when this pure fluid comes in contact with the capillary, with the outer layer of the capillary, there will be an exchange of the toxic metabolites which are not excreted from the not excreted anymore from the kidney, and now we can excrete it in the dialysis fluid, which will then removed afterwards.
So you put it into the trash.
We put the used dialysis fluid we put in the trash.
So it's like the kidney does with the urine.
Yes.
You put into the loo, you put this into
Yes.
the trash.
It's only a higher amount of volume, but that's the same.
Okay. So how often do you have to perform dialysis?
Yeah, you normally have to perform dialysis three times a week for 4 to 5 hours, and to be efficient. But unfortunately, efficient means only that you get with this procedure that you reach only about 10% of the normal kidney function, which you have during 1 week.
But that's enough for the body?
That's enough for the body, but that means that a patient, of course, has an advanced kidney failure.
If I would imagine that I have to go, say, for 3 or 4 times a week, go into a hospital setting, get myself hooked up to this machine, and spending hours of my time, it's very, very difficult for me to put into my busy life. So could I do this dialysis overnight when I'm sleeping?
If you are in good physical and mental shape, and you have a good fistula, a good vascular access, as we call it, then you can go to the dialysis at 8 o'clock in the evening or 10 o'clock and get the needles in and sleep there for 6 or 8 hours and leave the dialysis unit in the morning and doing your work or your free time.
But why do you have to be in good shape to do this overnight? Is it because the doctors go to sleep overnight and they can check on you?
There is some kind of limited care in these units. There is a doctor saying hello to the patients, and then there is only a limited number of nurses looking for the patients. But the real important reason is that it's impossible if you have a bad vascular access, or if you have some heart pain, it's not possible to look for this patient all over the night. That will be too complicated.
Okay, so it's really more about like a hospital problem than for a patient problem. For last chance, if you want to escape dialysis, you certainly think about a kidney transplant. What kind of patients are eligible for this?
Normally, all patients are eligible for a transplant. It does not. It is not depending on the age of the patient, sondern on the physical and mental constitution. If the patient is in a good shape, then he is normally accepted for transplantation. Of course, he will be checked before if everything is all right.
If I want to have healthy kidneys, can I do anything about this to prevent kidney disease?
We should check every year at least once our kidney function and the loss of protein in the urine. And if there is something wrong, we should look for a specialist who is taking care of us.
Thank you, Dr. Karl, for inviting me into your clinic. And thanks, Mr. Gast, that we could join you during the dialysis. And if you've got any questions you'd like me to ask our experts, be sure to write me.
Next time on In Good Shape, we explore the world of Ayurveda. The ancient healthcare tradition from India is becoming increasingly popular around the world. What benefits do the treatments have, and what should you pay particular attention to? Write to us at ingoodshape@dw.com with Ayurveda in the subject line. We look forward to hearing from you.
I really like this next report. Babies are helping the elderly with dementia.
When Theo smiles, so does Anita Pitfeld. Not a response you might expect, given that she has severe dementia. Talking to her, the gaps in her memory soon become apparent.
Do you have children, Mrs. Pitfold?
In fact, she does. She just doesn't remember. Her granddaughter wants to keep her grandmother's memory alive, but faces an uphill struggle.
That's Mum and Granddad Hans, Bernie's dad.
But Anita Pitfeld doesn't recognize any of them. The disease alters her character from one day to the next.
She's now really lethargic. Sometimes she gets angry and then introverted because she doesn't know what's happening to her.
Typical symptoms for dementia patients. Gerontologist Johanna Paul works in dementia therapy and knows how much pain memory loss can cause. It tends to be earlier memories that go first.
Memories from your own childhood become buried deep down. Because they're stored in the implicit or unconscious memory, they're no longer properly accessible.
Johanna Paul launched a project a year ago called Baby Watching to wake up those childhood memories. Little Theo is a regular visitor to the residents of this retirement home. The idea is for the toddler to coax out those buried memories. Lo and behold, as soon as Theo turns up, the dementia patients liven up. All his little smiles and chuckles have a positive impact on the elderly residents.
He's turned his head around.
The idea is that the sight and sound of a mother and child bonding and interacting will trigger forgotten emotions in the residents.
Why does he put his pacifier in and out of his mouth?
Because it's fun. Like an accordion.
Maybe. Or maybe he wants to make music.
When he gets a bit older.
It doesn't take long for Theo to work his magic. He's very much the centre of attention and the master of ceremonies. Carer Nicola Kursova works with the dementia-afflicted seniors every day. She sees their encounters with Theo as an enriching experience for the residents.
The crucial element for me is that people with dementia live in the moment. And the moments we experience during baby watching are really intense, something you otherwise can't replicate in a home.
Edith Nast has built up a deep emotional bond to baby Theo. She can remember his previous visits. Her memory loss is still at a very early stage.
Do you like it better here since Theo started coming? Why?
It gives you a little boost.
It brightens up your day?
Anita Pitfold has a different form of dementia, one that results in any memories being extremely fleeting.
Do you remember Theo being there last week?
Last week?
But then, towards the end of the session, a song from her childhood brings back old memories. The whole group joins in, a rewarding moment for everyone involved. And while the patients react differently to Theo depending on their form of dementia, the project organisers see progress among all of them.
Among the residents we've been accompanying for almost a year, we're starting to see a pattern. The decline is far less substantial than with other residents who are not taking part in the project.
For 20 minutes today, Theo brought a lot of cheer into the lives of the dementia patients. Hopefully some of those moments will remain treasured memories.
And here's some more interesting facts from the world of medicine.
The human eye can make out around 200 different shades of color, but not all eyes are equal. 0.4% of women and some 8% of men suffer from color vision deficiencies, such as not being able to distinguish red from green. A malfunction in the sensory cells of the retina which forward light stimuli to the brain. Normally, in bright conditions, the cones are tasked with seeing colors. The rods respond to dimmer light sources and enable us to see in the dark, but they are unable to discern different colors, as anyone can see for themselves after dark.
Traveling is fun, unless, of course, you're prone to motion sickness. Here's how to prevent it. Our tips.
Nobody is completely immune from travel sickness. Around 1 in 10 people are extremely sensitive to motion sickness, a condition called kinetosis. Many of them will become nauseous riding on a bus or at the slightest hint of turbulence in the air or at sea. But what explains the stomach churning and headache-inducing condition? Despite the name, it's not actually a sickness. It's down to a kind of sensory conflict. While your eyes see a stable environment, the vestibular system, located inside the ear and responsible for balance, has a different perspective. The rocking motion on board a ship means non-stop movement, causing major confusion. The body is overcome with nausea, but there are remedies if it gets insufferable. The easiest solution is chewing gum, but modern medicine also offers a range of pills and suppositories. They inhibit the central nervous system and suppress the urge to vomit. Alternatively, your doctor can prescribe a patch, but most of the options have a drawback: they make you tired. So you shouldn't drive a car when under the influence of these remedies. There are also a few simple tricks that might help you out. Those prone to nausea should be well rested prior to travel, eat only light foods and avoid alcohol completely. Choosing the correct seat is also important. On an airplane, you're best off in the middle, between the wings. On a train, be sure to be facing in the direction of travel. And in a car, sit up front. On a ship, stay on deck and close to the center, and keep your eyes trained on a fixed point on the horizon. Finally, how about a good old household remedy? Whether eaten fresh or drunk in tea form, Ginger can also help alleviate the symptoms of nausea. Plus, there are no side effects. But if you've got a cruise coming up, don't worry about having to drink ginger tea for a whole month. The symptoms tend to wear off after 2 or 3 days, after your body gets used to conditions. From there on out, it should be plain sailing.
I hope today's show stretched your knowledge of medicine. See you next week, and let's all try to stay in good shape.